implications. Joining me live now, Democratic Congresswoman of California, Karen Bass, a strong supporter, of course, of the president's health care law. She's held town halls in your district. And I want to start off with already there was an expectation, if there was a glitch or a problem, that critics of Obamacare would certainly be vocal. And we have new comments from Darrell Issa in your home state of California, Republican, of course, who says that while President Obama was busy telling Americans that an increasingly unpopular law is here to stay, sources from his administration were telling reporters that there would be yet another delay. This one denying small businesses the ability to enroll online. He goes on to talk about the expense and the confusion related to Obamacare. Your reaction to this glitch, and again, your Republican colleague in the House and others pouncing on this.
Well, first of all, I would definitely want to verify that, because one of the things that I think has been so tragic over these past few months, and especially now, is the extreme effort that the Republicans have gone to create absolute confusion and distortions. One of the things that I always look to as a former health care provider is things like pre-existing conditions and caps on health care coverage. Those two provisions alone are absolutely going to save lives, and I know that for a fact, having worked in an emergency.
Well, you said you wanted to verify. Are you referring, though, to this delay? Because it's been confirmed it's a 1-month delay for online enrollment for small businesses.
I see. Well, you know, and let me just say something. Anytime you have a massive change like this, there are going to be issues. There are a lot of difficulties with the law. Unfortunately, the Republicans have a position of repeal and nothing less. If they were cooperative and accepted the fact that this is law, the Supreme Court has validated, we need to move forward and figure out how we repair the things that need to be fixed. If you remember Speaker Boehner, the day after the election, he was the first one to say, this is law, we need to accept it, and we need to move forward. I think Darrell Issa needs to listen to his speaker.
In moving forward, we know that the most important step as it relates to October 1st is helping people understand what they are signing up for, what their options will be. I know that a recent report showed, for example, 80% of African-American voters were in favor of the law, 2/3 of Latino voters. You've held town halls. We also know that it's significant in that young people will be needed for this to work effectively here. But what is the primary question you're hearing now 5 days out from your constituents?
How fast they can sign up. I mean, I'm fortunate in California because our state is 100% behind it. People are just anxious to sign up. They want to know how they can take advantage of it. And the big thing they're asking is... So there are no worries about costs? I mean, you don't hear any... Go ahead. People, again, are waiting to see exactly what the cost is going to be, but most of the people that I'm talking to who are anxious to sign up right now have no choice because they have a pre-existing condition or they have no health insurance. And so costs, of course, people are concerned about that, but when they see that the cost in California came in a lot lower than expected, they're going to be very pleased. And I imagine, and this seems perhaps an obvious question here, but from what it sounds like here, you're quite confident in 5 days. The administration is expecting it to take off slowly, but you're confident that people will get online and be able to understand and move forward with enrollment here. Well, I will tell you that I'm confident in my state because my state is behind it, but I am concerned about states where the Republicans are in control and they're doing everything they can to create misinformation and confusion. And so that is a concern for me. But outside of that, and I really think that my colleagues, their primary concern is, especially getting into next year when people are taking full advantage of this, that they're going to have a hard case to make on repeal, because then they're going to be taking something away from people, and that's just not going to go over well. All right, Congresswoman Karen Bass, thank you so much for your time today. We greatly appreciate it.